Hi everybody, my name is James Burnham and I'm with the Minnesota Department of Natural Resources. I'm the Hunting and Angling Recruitment, Retention, and Reactivation Coordinator for the state. And I am here with Kelsey Lashar from Wildlife Health, and we're going to show you how to gut a deer with a knife and a zip tie.
So we'll go ahead and get started. With us today we have an adult doe. So there's lots of different ways that you can skin a deer. And so a lot of people either start down here or they'll start up here. What we don't want to do is start here in the middle. So this is where the stomach and all the intestines are. And if we accidentally perforate this and that spills out, it's going to be quite a stinky, smelly mess. For today's example, we're going to show you how to gut starting down here. So I'm going to make a small incision right here. We're going to work our way backwards, deal with the back end, and then work our way forwards after that. So I have a knife. This one does have a gutting hook on it. So I'll kind of show you how you can use this. You'll see that this is not a very big blade. This will work perfectly fine to gut out your deer. So I'm going to make my first cut. I'm going to try and avoid the mammary sacs right here. What you can do is you can pull the skin up, make a little bit of a tent, and then go ahead and make an incision. And then if you cut through the hair, you're going to dull your knife really, really fast and drive hair into the meat. So what you want to do is start from the inside and always be cutting out. You don't want to ever cut into the hide for a number of reasons. So I'm going to make my cut down. Again, you'll see that I'm pulling the skin up, which gives me lots of room to move the knife down. All right, so I'm pull the skin away and I'm cutting back down towards the rectum. So at this point, what I want to do is I'm going to loosen up the urinary tract and the colon. So I'm going to cut in a big wide circle around both openings. I'm cutting right up above the tail right there. All right, so you can see I have this part that's been completely pulled apart from the pelvic bone. And so I'm just gonna run my finger along and just make sure that, it all feels like it's fairly well detached. Okay, so next what I'm gonna do, I have a zip tie. And so I'm actually gonna pull the colon out and I'm gonna zip tie this closed. So then when we go to pull this out, that we don't have feces getting all over our meat. All right, now I'm gonna go around the outside here and then go kind of all the way up just past the sternum. Again, I'm pulling the skin up while I cut, so I make sure that I'm not actually cutting any of those organs. And I want to try and also make sure I avoid her mammary glands, because if she is lactating, we don't want to spill any of that milk on the meat. And so you can see in here, this is all connective tissue. I can cut through it with my knife, but you can also you can just rip through it with your finger. And so this is what we're actually cutting when we're skinning a deer, is we're cutting that connective tissue that holds the skin to the muscle. So I'm going to keep going up here up the side of the deer, and there's two ways you can do it. One, some knives have this thing called a gut hook, which is that little hook, and it's got a very sharp blade in there, and so you can actually hold it against the skin and pull up, and it will just cut through the skin like that. Not every knife will have that though, so I'm going to demonstrate how to do this if you don't have a gut hook. And so basically you want to take two fingers, and you're going to hold the blade between them, and then you're going to just run up like that. And what you're doing is you're pushing your fingers down against the organs while your knife is coming up against the skin to cut through it. So here's my fingers. I'm pushing down with my two fingers on her organs. And then cutting up with the blade. And right now you can see that there's a little bit of a skirt, like the skirt stake. You're going to have to cut through some muscle here. It may be hard to get through that connective tissue. And always be pushing down with your fingers in your hand as your knife pulls up. Make sure no one's face is in your way because you don't want to accidentally be nicking them in the face either. All right. So I'm going to come back down here and try and get the rest of this hide pulled away. Again, be careful if she is lactating. You just want to make sure that we're not hitting that mammary gland at all. And so sometimes it'll pull easy, especially if the deer is really fresh, but sometimes you have to help it a little bit along with your knife.
And Kelsey, as you're cutting that, you're cutting down towards the underside of the skin. You're not cutting into the animal. As you pull that skin out, you're cutting on the back side of the skin.
Correct. Okay, so the next part is, again, this is the abdomen. She's, you can tell that she's a little bit tight right now, so we want to be very careful that when we cut through this.
You can feel where the ribs are versus where that soft belly is. And so you find the ribs and you come right down onto the sternum, and you can even kind of work down in there. And again, just like you did with the hide, you can get your fingers in there as a guide so that you're not puncturing anything, and that'll open up that abdominal cavity.
And you don't have to make big, don't feel like you have to do this all in one wide stroke. Some people can, but if you just need to go through and make small cuts at a time to make sure that you don't poke the things you're not supposed to poke, including your own fingers, definitely take your time as you're doing this. So again, I'm pushing backwards and down with my hand and my fingers as I cut up with the knife.
And this is another place where you could use that gut hook as well.
I'll do that for...
Just got to be careful that you don't snag any of that internal.
Okay, so now we're going to pull these organs kind of out towards us. It helps if you have your deer up on a little bit of a hill. So as you're gutting your deer, the guts are going to fall sort of out and to the side. I'm also going to point out a couple organs in here. So this stuff is all normal. This just kind of holds all of the intestines in place. So this big one right here, that's full of all the air, this is a rumen. If we were to perforate this, there'd be a lot of very smelly gas and some liquid. So we want to be very careful about that one. These are the small and large intestines that I'm gently pulling out. All right, so next, if you can see here, there is the diaphragm. And so this is the piece of skin between your abdomen and your chest that helps you to breathe. It's connected to the rib cage all the way around. And so we want to pull that apart. That has to be completely pulled off the rib cage before we can pull the rest of the organs out. And so again, it's connected all the way around, so you're gonna have to reach underneath the organs in some places to be able to get to that. All right, so a couple organs I want to point out real quick. The first one is a spleen. So this is a bluish, purplish organ, sometimes greenish. And it kind of looks like a cat tongue. It's going to be super folded. It's about the size of your palm, so not too big. Here, I'll cut it so you can see it without blood, but you can see it's quite purple inside. The other one that people are often interested in is the liver. And so this is another purple organ. James has it right here. I'll try and pull it out a little bit. Looks like it was shot through the liver. But this is also purple, except it has several lobes. And so lobes are kind of like a rounded part of the organ. Also quite purple. So if I cut into it, you can see it's also purple. And it's, at least 2 of your hands, if not a little bit bigger. Okay, so, we still have some organs attached because obviously with your digestive tract, it goes all the way through your body. So we need to go as far up into the deer as possible, find the highest point we can on the trachea and the esophagus, make an incision there, and then pull the rest of the guts out. And so as I go up, I'm going to be going up along the backside between the spine and the rest of the organs, and there's going to be some landmarks along the way. So the first one that we will be looking for is the heart. So it'll be, fit in my hand pretty well, so about the size of a Nerf football. And then there'll be some more stuff as I go up. So the one thing, this is why you don't need a massive knife, is because your hand and that knife are going to be in the same very small area. So as you go in there, be very aware of where your hand is and that you don't cut it as you're trying to cut the esophagus and the trachea. All right, so I have found the heart, and at this point I don't have my knife in there yet because I'm just trying to feel in there, how far up I can get before I have to bring the knife in there with me. So the esophagus is going to be sort of smooth and round, whereas the trachea is going to be have ridges on it. So it'll be more of like a ribbed tube that goes all the way up to your throat. And so we're looking for that trachea. I found the esophagus. There is the trachea. And so it's, not very big, maybe this size, especially once it gets down there, maybe a couple fingers, and it's got ridges on it. And so now that I know where it is, I'm going to go in with my knife, find where I was before, being very careful not to cut myself. All right, so I've cut through the trachea. So now I should be able to pull the heart, the lungs, and the rest of the organs should all come out together. There'll still be some connective tissue, so you might have to gently encourage it to come out. All right, so we have everything from the upper cavity is done, and now we're gonna try and work on this back end. And so if I was successful enough, then I should just be able to use my fingers to gently move this colon and pull it through to our end. All right, and there's our zip tied end. And so as you can see, this girl had quite a bit of fat on her. So all this stuff we're seeing in here is fatty deposits. That's all fine. If you want to get it cleaned out right now, you certainly can.
And that is a gutted deer, just with a knife.
And a zip tie.
And a zip tie. Some people cut through the pelvis, some people cut through the ribs. You don't need to do that. It's a step that you can do, but in some places with disease management, it's not recommended. And honestly, it's one less thing to carry in the woods. So, fantastic.
Happy hunting.